10 silent signs your dog might be sick. And you're missing them. Dogs are experts at hiding pain. In the wild, showing weakness can make an animal a target. That instinct hasn't left our furry companions, even though we've domesticated them. Because of this, many dog owners miss early warning signs that something might be wrong. Today, we're uncovering 10 often overlooked signs that your dog might be sick, explained clearly and with specific examples. If you're a dog parent, this could be one of the most important things you learn to protect your pet's health. 1. Subtle changes in behavior or personality. What it might look like. A playful dog becomes quiet and reserved. An independent dog becomes clingy and constantly seeks your attention. Confident dog suddenly seems nervous or jumpy. Why it matters. Behavioral changes are often the first indicators of illness. Just like humans, dogs may act differently when they're not feeling well. But unlike humans, they can't tell you what hurts. What could be behind it? Pain from arthritis, injury, or internal issues. Hormonal imbalances, like hypothyroidism. Early signs of neurological problems. Hidden infections or even cancer. What to do? Start tracking when the behavior changes started. Look for patterns. Does your dog act more off after meals? During walks? While resting? Share this information with your vet. 2. Slight decrease in appetite or change in eating habits. What it might look like. Skipping a meal now and then. Taking longer to eat. Picking at food. Only eating treats, not regular food. Why it matters. We tend to panic when a dog stops eating completely, but subtle appetite changes are easier to miss and just as important. Possible causes. Dental pain. Upset stomach. Kidney or liver disease. Tumors or mouth ulcers. Food sensitivities or allergies. What to do? If your dog eats less than usual for more than 2 days, it's worth checking in with your vet. It's also a good idea to examine the mouth, gently, for signs of pain or swelling. 3. Unusual sleeping patterns. What it might look like. Sleeping more than usual, even for a normally lazy dog. Restlessness at night. Napping but not seeming well rested. Why it matters. Too much sleep or difficulty resting can be signs of discomfort or internal illness. What could be behind it? Pain from joints or injuries. Low red blood cell count, anemia. Hormonal disorders. Organ dysfunction. What to do? Track how long your dog is sleeping and whether the sleep seems deep or interrupted. Watch for signs like shifting positions frequently or waking suddenly. 4. Bad breath, not just doggy breath. What it might look like. Breath that smells sour, metallic, or unusually strong. Drooling more than normal. Avoiding chew toys or hard food. Why it matters. A dog's breath should have a mild odor. If you notice a new or worsening smell, it could point to dental disease or something more serious. Possible causes. Gum disease or infected teeth. Kidney problems. Breath may smell like ammonia. Diabetes. Sweet-smelling breath. Oral tumors. What to do? Smell your dog's breath weekly. If you detect strong or unusual odors, consult your vet. Routine dental care is not just cosmetic, it's life-saving. 5. Licking or chewing one spot repeatedly. What it might look like. Constantly licking a paw, leg, or joint. Chewing at a particular spot until the fur is gone. Whining while licking. Why it matters. Repetitive licking often indicates pain or irritation, either external or internal. What could be behind it? Arthritis or joint pain. Skin infections or allergies. Nerve damage. Emotional distress. Compulsive licking. What to do? Check the area for signs of swelling, redness, heat, or wounds. Even if the skin looks normal, there could be pain beneath the surface. 6. Eye changes, even slight ones. What it might look like. Eyes look dull or cloudy. Increased tear production or discharge. Redness in or around the eyes. Squinting or avoiding light. Why it matters. Eye health reflects overall health. And many systemic diseases first show up in the eyes. Possible conditions: infections, conjunctivitis, dry eye syndrome, glaucoma. High blood pressure can cause eye bleeding. Immune system disorders. What to do? Take note of any eye color changes, squinting, or unusual eye behavior. Eye issues can progress quickly, so early vet attention is crucial. 7. Changes in weight, even small ones. What it might look like. You feel ribs more than usual. Collar seems looser or tighter. Gradual weight loss or gain. Why it matters. Weight fluctuations often indicate metabolic or digestive problems. But if they happen slowly, many owners don't notice until the change is significant. Possible causes of weight loss: parasites, diabetes, hyperthyroidism, cancer, malabsorption disorders. Possible causes of weight gain: hypothyroidism, Cushing's disease, poor diet or lack of exercise, tumors or fluid retention. What to do? Weigh your dog monthly and keep a record. A digital pet scale or even a bathroom scale, weighing yourself with and without the dog, can help catch changes early. 8. Changes in urination or bowel movements. What it might look like. Peeing more or less frequently. Urine has a stronger odor or different color. Accidents in the house. Soft stool, diarrhea or constipation. Why it matters. Just like humans, dogs often show signs of internal illness through waste output. These changes are often the earliest symptoms of kidney disease, bladder infections or gastrointestinal issues. Urine changes might indicate urinary tract infections, kidney dysfunction, diabetes. Bowel changes might signal food intolerance, parasites, pancreatitis, colon issues or tumors. What to do? Observe your dog's bathroom habits regularly. Scoop the poop, inspect the color and texture, and note any changes. You are your dog's best health detective. 9. Reluctance to jump or climb stairs. What it might look like. Hesitating before jumping into the car or onto the bed. Avoiding stairs or walking slowly down them. Stiff movements or limping after resting. Why it matters. Dogs rarely show pain directly. Instead, they adapt their movements to avoid discomfort. This change in mobility is often a red flag for musculoskeletal issues. Possible causes: hip dysplasia, joint inflammation, spinal problems like IVDD, muscle injuries. What to do? If your dog suddenly stops jumping or seems stiff, don't assume it's just age. Have your vet check the joints and spine, and consider supplements or physical therapy early. 10. Just a different feeling. You know your dog best. What it might look like. A vague sense that something is off. Your dog's energy feels different. Interactions seem slightly unusual. Why it matters. This might be the most powerful tool you have. Dogs are part of our lives, but to them, we are their entire world. You probably know your dog better than anyone else. What could be behind it? Early signs of illness not yet visible. Mild pain or fatigue. Emotional changes or anxiety. What to do? If you feel like something's wrong, trust your gut. Many dog parents have saved their pet's life simply by acting on a hunch. Final thoughts. You are your dog's voice. Dogs don't complain. They won't tell you when they're in pain. But their bodies always give signals, if you know how to listen. Here's a recap of the 10 signs. Subtle behavior changes. Decreased appetite or odd eating habits. Unusual sleeping patterns. Bad breath or oral changes. Excessive licking or chewing. Changes. Weight gain or loss. Pee or poop changes. Reluctance to jump or climb. That off feeling you just can't shake. You don't need to be a vet to recognize these signs. You just need to observe, care, and act. Even if it turns out to be nothing, early intervention can prevent small issues from becoming life-threatening. If you found this helpful, consider sharing it with a fellow dog parent, because awareness saves lives.